Hello everyone. Today our team Ujwala, Shri and myself Lakshmi are going to present our project that is Actionable AI predicting antidepressant response using patient history and coefficients data. The goal of our project is to use AI to personalize antidepressant recommendations, addressing the trial and error nature of current clinical practices. Overview of projects. In our class, we are working on 5 impactful projects that leverage AI and data driven techniques to address challenges in healthcare. Each project focuses on an unique area, pushing the boundaries of what technology can achieve in improving patient care. Today, we'll be discussing one of these projects, that is Actionable AI, predicting antidepressant response using patient history and coefficients data. This project stands out because it tackles a critical issue in mental health treatment, helping identify the most effective antidepressant for a patient. By analyzing individual medical histories and using predictive modeling, we aim to make antidepressant selection more precise, reducing the time and frustration often associated with the trial and error approach to treatment. Goal and objective. The goal of our project is to improve antidepressant selection through predictive modeling. Our objective is to analyze patient history data, calculate probabilities of success for various antidepressants, and provide personalized recommendations. This approach has the potential to transform the way depression is treated, making it faster, more precise, and less frustrating for patients and clinicians. Background. Depression is one of the leading causes of disability globally, affecting millions of individuals. Current treatment methods can involve a lengthy trial and error process with failure rates of up to 40% for first line antidepressants. Our project leverages AI driven modeling to overcome this challenge. By identifying the best antidepressant for each patient, we can improve remission rates, reduce delays in treatment, and enhance patient outcomes. Coming to methods, firstly, we created a synthetic patient dataset capturing variables like prior antidepressant trials, remission status, and depressive episodes. Then we computed important indicators such as ADRM4DN and NIPI2+. Later, using a regression coefficient file, we aligned patient data with corresponding weights to calculate the likelihood of response. Finally, logistic regression was used to compute probabilities of response for 16 antidepressants, providing a clear ranking of options for each patient.
A synthetic dataset was generated to represent patient medical histories. For each variable, a binary system 0 and 1 was applied randomly. 1 indicates the presence of a specific condition, medication, or treatment history. 0 indicates the absence of that condition, medication, or treatment history. This random assignment reflects the variability observed in real world patient data. To handle the missing data, we are intentionally introducing nonce into the dataset to simulate incomplete patient histories as often seen in clinical data. Response column was added from the coefficient file for identification of any missing predictors for the respective response drug. The key predictors like ADRM4DN, NEPI2+ diagnosis and procedures were taken from existing data using predefined clinical rules. These variables added depth and clinical relevance to the dataset. Coefficient processing. After preparing the patient history, we moved on to processing the coefficients, which are essential for linking predictors to the likelihood of responding to antidepressants. Coefficients represent the strength of the relationship between each predictor and the outcome. First, we have the original coefficient file. From there, we are creating a coefficient 1 file where the predictors or strata were set as the index. Response variables were set as columns. The coefficient values from the original file were mapped to the appropriate predictor response pairs. Some predictor response combinations contain missing values, and for that we are creating a secondary coefficient file where all the missing values were imputed as 0. We are treating them as absence rather than an incomplete data. Finalizing the coefficient file, the patient history was then analyzed alongside the coefficients. If a response from patient history had no missing predictors, values are directly taken from the coefficient 1 file. If any missing predictors were present for the particular response drug, then the values were taken from the secondary coefficient file where missing values have been filled with 0. This process results in a final coefficient file that accurately aligned with the patient history, ensuring consistency and reliability. Regression analysis. In this step, we use matrix multiplication to compute regression scores for each antidepressant. This method is efficient and ensures accurate integration of predictors and coefficients. Patient data was structured into a matrix, with each row representing a patient's predictors. Coefficients for all antidepressants were organized into a separate matrix. This resulted in a matrix of scores where each cell represents the likelihood of response for a specific patient and antidepressant. It enables simultaneous computation for all antidepressants, ensuring consistency and efficiency in large datasets. Regression scores were computed for all 16 antidepressants, forming the basis for probability calculations in the next step. Once the regression scores were calculated, we transformed them into probabilities using the sigmoid function. Convert scores to probabilities. Regression values were converted to probabilities between 0 and 1. Higher probabilities indicate higher likelihood of success. Interpretation. Each probability represents a chance of a specific antidepressant being effective for the patient, and these probabilities were saved as effective drugs for each patient. We ranked and visualized these probabilities to make them actionable for clinical decision making. This step bridges the technical analysis with practical application. Our results highlighted significant differences in antidepressant effectiveness. Ranking antidepressants, the computed probabilities were sorted for each patient to identify the most effective antidepressant option. Rankings were based on the likelihood of success from highest to lowest. Bupropion achieved the highest response probability at 70.64. Trazodone scored second with 67.54%. And then probabilities for all 16 antidepressants were visualized using a horizontal bar chart.
So coming to visualization, this provides a comparative analysis of the effectiveness of various antidepressants visualized through a horizontal bar chart and supported by a table listing their probabilities in descending order. So this chart ranks drugs from most to least effective, with bupropion, amitriptyline and trazodone consistently showing their high probabilities of success. In contrast, fluoxetine and venlafaxine are among the least effective options. So the other drugs like mirtazapine and escitalopram exhibit moderate effectiveness, while sertraline and paroxetine demonstrate lower probabilities of response. So this visualization highlights significant variability in drug efficacy, emphasizing the importance of targeted selection for clinical decision making. So the next accompanying table provides numerical details of the likelihood of response for different antidepressants across individual patients. That is, as we have taken the patients from 1 to 16, and each column represents a specific drug, that is the antidepressant drug, with values indicating the probability of its effectiveness for the corresponding patient. So this data helps identify the drug with the highest likelihood of success for each patient, facilitating personalized treatment planning. So together, the chart and table provide an interpretable representation of drug efficacy, understanding the importance of tailored medication selection to achieve optimal outcomes in clinical applications. So next, coming to effectiveness. This highlights the comparative analysis of drug effectiveness by categorizing them into high and low effectiveness groups, along with the supporting code which we have given in the right side and results. So here, as we discussed in the earlier slide, that the high effectiveness drugs include bupropion, trazodone, and amitriptyline, which is showcasing their significant probability of success. In contrast to that, low effectiveness drugs such as fluoxetine and venlafaxine exhibit minimal probabilities. uh, so coming to the right side, there's a code given, that is the Python code, which shows the which is calculate and print the most effective and least effective drugs based on their average probabilities. So the results confirm that bupropion is the most effective drug with a probability of 70.64%, while venlafaxine is the least effective with a probability of 1.50%. So this analysis emphasizes the importance of selecting drugs with higher effectiveness for better treatment outcomes. Coming to patient specific recommendations, so we have three main categorized, like relevant medical history and what is our advice and notes. So first we'll see with the relevant medical history. So we assume that you have major depressive disorder. If not, this advice may not be suitable. So it also does not apply to bipolar disorder. So it is mainly based on your medical history. The following factors are relevant to selecting the appropriate antidepressants. So the major uh, factors like history of using antidepressants other than the recommended drug without achieving remission, that is ADRM underscore 4DN, it is represented as like that. So two prior antidepressant trials, that is NADP 23, like it is 2 or 3. uh, then coming to more than 2 depressive episodes in the past year, so it is represented at NEPI, that is 2 plus, as it is more than twice. And coming to partial remission of recurrent major depressive disorder, so these are the basic medical history, like we have followed these factors. And coming to our advice, we recommend bupropion as there is 70.64% likelihood you would respond to this medication, and alternatively trazodone is a strong option with a 67.54% response rate. So while slightly lower, this difference is not substantial. And our notes, like, please consult your primary care provider before making any changes to your treatment, and avoid abrupt adjustments as they can be harmful. For more information about bupropion, please visit NCBI hyphen bupropion, and that is like we can get the information of uh, bupropion medication. So coming to limitations, here we have some of the limitations for our model, like data quality, generalizability, assumptions, and interpretability. So first, coming to like some of the data qualities, like missing data, like we, while missing predictors, we assigned a value of 0. This may oversimplify complex relationships. And model assumptions, like logistic regression assumes linearity which may not capture all nuisances. And generalizability results depend on data sets representativeness, which may limit broader applicability. So acknowledging these limitations help guide future improvements. So finally, coming to conclusion, uh, in our conclusion, our project demonstrates the potential of AI in transforming antidepressant selection. By leveraging patient history and predictive modeling, we can reduce the trial and error process, providing faster and more effective treatment options. So this project showcases mainly on the power of data-driven healthcare and its potential to improve clinical outcomes. Thank you for your attention.